I think the most important thing about the 7 steps of a hearing test, it all has to be patient-centric. Everything that we do focuses in on the needs and the nuances of any particular patient that comes in with us. Step 1, the first thing, is our case history. That's a thorough conversation and detail that we go through with each patient. What we do is we take a little bit of detail, personal detail, anything of a medical nature, but we also look at the trials and tribulations, shall we say, of what's been going on in their life with their hearing, what they've been noticing, what the family are noticing, and really getting into the detail of how it is actually affecting them in their life. Step 2 is our videotoscopy. That's really important as well, because we need to check the condition of the ear, exactly what's going on in there. So what we will do, first of all, we will actually use just an ordinary otoscope just to orientate, to look round the ear and make sure there's no scarring or anything like that round the ear. But we're also looking then at the entry right all the way through the ear canal, all the way to the eardrum there. So videotoscopy actually is a completely non-invasive. It just involves almost like a little light source going into your ear, where the audiologist can actually pick up all the images on a big screen. In fact, as a patient, you can actually see yourself what's actually going on. So it's quite intriguing and quite informative for the patient as well. But it's completely non-invasive. Step 3 is what we call pure tone audiometry. Pure tone audiometry actually, again, is non-invasive. We actually use little earbuds. They fill the outer portion of the ear canal, and then we play a series of beeping tones. It's a behavioural test, so it's really about finding out the threshold, in other words, the least amount of sound that the patient can hear at each frequency. We record that in what we call an audiogram. So I suppose it's the same way that a cardiogram would record the function of the heart. This records the function of the hearing. Step 4 is what we call the familiar voice test. And this, I think, can be one of the most vital areas, because although we can measure the hearing, we also want to understand, not just for the patient, but also the family, just how much this is actually impacting. So in this particular step, we would ask the patient to sit and listen. We ask them not to look at their support as they read out a list of words. We also play a series of background noises to make it more lifelike. Speech understanding is really critical, because that's how we hear. That's how we actually function in life. That's how we communicate. It's how we live with our family, live in background noise in busy situations. The biggest gift that we have is our hearing and being able to communicate. So step 5 is hearing aid demonstration. It's the amplification side of things. It's when we've taken everything into consideration, not just the factors of where the hearing loss is, but also the considerations of how they actually struggled with some of the words in the familiar voice test. And then what we do is we program the hearing aids exactly to their hearing loss. We would then carry out the demonstration, and that involves doing the very same test that we did without amplification, where we use the familiar voice again to read out a list of words, and that's where we start to see the improvement. Step 6 is the fitting. The fitting really is where they've taken all the evidence and now we've got to put it into practice. We've got the particular instrumentation that's not just going to fit their hearing loss, but their lifestyle and their personal needs and their personal goals. We like to make sure that not only is the patient fitted with what they need, but also show them how to use the instrumentation, how to take them in and out. It's also about creating a care plan for them where they can integrate the hearing care into their actual lives. So step 7 is our follow-up and our aftercare. And I actually believe that this is really where we make the difference, because we take a thorough amount of time to make sure that not only have we fitted the hearing aid successfully, but we care for their continuing journey. Aftercare is really essential because things may change. Just because we've helped the hearing still may deteriorate due to the aging process, or maybe other factors due to illness or medication or something like that. So what we want to make sure is we're holding the hand of the patient. We're making sure that we've got an accurate account of where their hearing is. So having fine-tunings and reassessments and really caring for that patient makes sure that they keep the hearing that they've got in the first place ongoing, and they have that quality of life for the rest of their life. So a big part of the 7 steps isn't just about the diagnosis, the tests that we do. It's actually understanding, it's asking the right questions, understanding where the patient's coming from, really getting into what their hopes and needs, the nuances of really what it means to them to have life-changing hearing care. That's for me what it's all about, the care.